When did I last feel joy? Pretty much 1 in 4 women are experiencing depression. Mental ill health figures are climbing. The reproductive hormones. What has that got to do with anything in mental health? Got everything to do with mental health. The biggest presenting issue is anxiety. There's no health without good mental health. Holistic care of self is one of the biggest things that women can do for their mental health. First step is to actually talk about it. We are expecting a lot from ourselves. So sometimes I've taken out my prescription pad and prescribed half an hour of pleasure. Did you know that women matter?
What?
Women are important.
That's crazy. You've lost me again.
The message is finally out there.
This is Fernwood Unfiltered, the podcast with straight up expert-backed advice when it comes to women's mental and physical fitness. And if you're navigating mood swings, stress, or you've got changes in your mental well-being, you're craving clear, expert-backed guidance on how hormones, life stages, and everyday life affect your mental health, I've got great news. This episode is the one for you. Professor Jayashri Kulkarni is a world-leading researcher in women's mental health and the founder of the Women's Mental Health Research Program at Monash University. With decades of experience studying how hormones, life stages, and social factors affect mood and cognition, she's a trusted voice on topics from perimenopause and postpartum mental health to hormone-related mood disorders. Jayashri combines rigorous science with a deep understanding of women's lived experiences, making complex mental health issues accessible and actionable for every woman. Dr. Jayashri, how does that sound?
Sounds like I've got a big job ahead of me in this podcast to kind of solve every single issue.
Well, I'm glad that you've said that because I do have it here. Dr. Jayashri will solve women's mental health. So that's good. We're off to a really strong start. No, what is the one message, though, that for the woman or the person listening to this podcast, what's the one takeaway you hope that they can get from our chat?
I hope people listening to this can get an understanding that, first of all, there's no health without good mental health. And in order to have good mental health, you have to have the biological factors, the psychological factors, and then your social or environmental factors all working together. And if there are issues in any one of those bits, it'll affect the rest and can lead to mental health impacts that are adverse. So I guess the big picture is integration and holistic care of self is one of the biggest things that women can do for their mental health.
Let's get to solving. We've got a big task ahead. How many women do you think, rough estimate here, successfully navigate all of those areas?
Oof. It's degrees.
Yeah.
So what's worrying is that I think it's getting tougher and it should be getting easier. So I often wonder, why is it that the mental ill health figures are climbing? You know, what is that? What's going on? What is that saying about what's happening? But at the moment, we have the issues of 1 in 4 women, pretty much 1 in 4 women are experiencing depression. 1 in 3 or 1 in 2 have some form of anxiety. The addiction issues to alcohol and other drugs of addiction has gone up. It used to be 1 in 12. I think it's now about 1 in 10.
Mm.
So, you know, these are all dreadful. And then you've got the eating disorders. And because I'm a doctor and a psychiatrist, I'm at the very pointy end of all of this. I'm dealing with, you know, diehard mental illness.
Mm.
So that's, you know, really, really the tip of the iceberg that I'm seeing. And yet that has exploded. So it makes me worried that if that's exploded, then the intermediary kind of not quite severe mental illness, but also not doing well, those numbers of women have also increased.
Right.
And I certainly think that during COVID we saw an explosion of what we call that missing middle.
Mm.
Why missing? Is because they don't often come to care.
Okay.
And
Why?
Often, well, for a start, the mental health services, public mental health services are really, really, really stretched.
Yep.
I can't put enough reallys in that sentence.
Mm-hmm.
And so can only take the very, very unwell. So that's one factor. The second factor is if you've got private health insurance, then you may be able to access some form of psychology or social work or psychiatry. But a lot of women don't have private health insurance, so they're kind of left. That's the missing group as well. And also, we're jammed in the private health sector as well. So there's just not enough to go around. And then we had this explosion of mental ill health related to the lockdowns and all of that. But I think related more to lifestyle issues as well.
What type of lifestyle issues? Are these the areas that kind of keep you up at night and you're trying to figure out, hang on a second, why are we struggling so much?
Well, I don't have all the answers, damn it. But,
all right, this is the end of the podcast. We're leaving.
But it's really an issue that today's 20 to 45-year-old and maybe even 55-year-old is absolutely strung out with trying to maintain a high-level paying job and climb up the corporate ladder or whatever ladder they're on, finding or keeping a mate of some sort. To have a meaningful relationship is one of the important things of life, but there's this kind of issue of how to do all that and balance all of that. And then the reproductive question. I mean, obviously women have many choices, but they've still got to make that choice. Do I, don't I, when, what, how? I mean, all of that. And then you put in the old sort of got to look good stuff as well. So what I feel like we've almost gathered more have-tos as we've gone along and not really dropped any of the have-tos. And that means that we're carrying a lot. So, and nobody gave us the sort of the superpowers. We didn't all suddenly just get, kryptonite powers to be able to, or from Krypton to be able to do these things. But we are expecting a lot from ourselves. Where do those expectations come from in your experience? So from your own patients, is there a common or most common presentation from all of them that they're all trying to find something, they're all trying to feel something? Is there a certain question that they're all wanting answered? The biggest presenting issue is anxiety.
Right, okay.
And many, many, many women present with, I'm not good enough. I'm not good enough. How do I get better? How do I get better? How do they see me as better? How do I see me as better? I'm just not good enough. And, the old phrasing was the fraud syndrome, but it's still there. And and there's a lot of anxiety about, do I sound right? Do I look right? Am I doing right? Am I doing well enough? Did I do this wrong? Did I do that right? There's a lot of guilt. Guilt is such a corrosive emotion. It's of no use really, but there's a lot of guilt and women pick up enormous amounts of guilt. Just listen to groups of women speaking to each other, the number of apologies. Oh. No, I'm sorry, yeah. But sorry. What are you apologising for exactly?
I remember I went to a comedy show once and it was a female comedian and she said how you spot a woman in a room is that if they run into a table, they'll apologise to the inanimate object. And I was like, yep, that's so true.
It's nice to be polite.
Yeah.
Right. But then I think we're adding a whole range of expectations, a lot of which are internalized as well. It's not that there is always this demanding ogre sitting on the shoulder, but there's an internalized expectation that you will behave a certain way, you will do a certain thing, you will look a certain way, you will achieve certain goals. And the question is, well, what if you don't? Then what? But the anxiety,
then what? I'm asking. Then what?
The anxiety builds enormously without really being able to just disperse some of that and say, hang on, that's an unreal expectation. That really is an unreal. So, it just gets compounded when women do have kids, and then there's a whole bunch of, demands about, am I a good enough mother? And the answer to that is always no. Being a mother means being continually guilty because no matter what you do, it's not going to please everyone. We've got I think that's part of the burden. I mean, obviously, there's all sorts of other practical things that happen. There are cost of living issues.
Of course.
There's standard of living issues as well. And we've got ourselves to a situation where we anticipate that we have a certain standard of living, and then you've got to earn enough to get there. If you don't, then you'll have financial worries. So there's that. I think the 30, 40-year-olds are at a different phase of worry to the 50, 60-year-olds that I see. So the 50, 60-year-olds are dealing with the just post-menopause issue, and we can come talk about that in huge detail. Whereas the 30, 40-year-olds are still are carrying the fertility question in a big way. And then they're also carrying the motherhood question and how to do it, not to do it, being judged either way.
Yeah.
So
also, I find that even from my own personal experience when it comes to friends and different, how your friendships change around that as well during this significant time.
Yes.
So, some people may focus on the family, but then for people who are maybe single or there's just no children on the horizon, maybe they choose not to have children, then that in itself can be quite an isolating experience to live through.
Absolutely. So, I mean, I totally agree with you, but, I was thinking back what I've been saying, it makes it sound like, oh, God, let's just go back in time. No, let's not go back in time.
No, we don't. Okay.
Because at least we have all these choices. We're out there, whereas if you think about the 1940s, 50s women, they were stuck at home, chained to the kitchen sink and had no choices. So choices are good. Absolutely. But choices can bring anxiety about making the wrong choice for self or consequences of things not going the way they were intended to.
What would you say over the course of your career or even your personal life has been one of the more frustrating myths or misconceptions when it comes to women's mental health? I mean, we've only got roughly an hour for this podcast, but if you could sum it up.
Well, I particularly began my work in looking at hormones and the brain. And by hormones, I'm specifically talking about estrogen, progesterone, testosterone, the reproductive hormones. Even that title, the reproductive hormones, is a misnomer. So when I started my research, people were looking at me like, you're a psychiatrist. What? Why are you doing this? What has that got to do with anything in mental health? It's got everything to do with mental health. So that is a misconception that these hormones, estrogen, progesterone, testosterone, are only about ovaries in uterus and having babies.
Yes.
They're not. They have big effects in the brain. So I feel so bad for the fact that so many women over time would go to their doctors and say, it's my hormones, doc. Something's wrong with my hormones. That's why I'm depressed. That's why I'm anxious. That's why I'm angry. That's why, etc., all the emotions and even the depressions and other conditions have come about. And they'd be told, no, don't be silly. Don't be silly. That's nothing to do with your hormones.
Dismissed, yeah.
Yeah. And it's actually very much that mental health and hormones in women and in men, but I'm not talking about men because I haven't done the research there, that they are intricately connected. And we still have to make that point, still.
Well, I would assume among your colleagues maybe or within the field, but potentially as well just with your patients themselves, accepting that sometimes it is their hormones, or are they more willing to do that? Or are they just no?
The patient population that I work with are so relieved when they come because they've got that understanding in themselves. But what has happened to her is that she's been invalidated. And so now she's got the double whammy. Like she's already got the problem, say it's a depression that comes on once a month. And on top of that, no one's believing her. And so she's got to convince the healthcare professional that this is real. And then she's also got to, get the treatment, push to get the treatment, which as many of my patients say, it's a hormone problem, bleeding obvious, it needs a hormone treatment. It's not rocket science. But most healthcare professionals don't do that. And I think that's so unfair. She's already made the diagnosis. She's done all the reading, as it were, and, and so it should be that the healthcare professional has an easy job of it to go, yep, good point, we'll do this.
What's impeding that?
The myth, the misconception and the myth that these hormones have nothing to do in the brain. They are all kind of below the waist. A very odd misconception. And usually, of course, healthcare professionals can't know everything about everything, but unfortunately, sometimes you get the sort of neuroscience research land moving forward at a pace, really good pace, but it takes a while for it to then actually be translated into clinical practice. And I think we've also got that gap as well.
I want to dig deeper into just how hormones affect everything, but you've actually stunned me there with the notion that reproductive hormones aren't just from the waist down. And
Nope.
I took such a visual moment then to be like, why have I thought my entire life it's just like it's like bet my navel down. That's the only place that those hormones can be. That's where they are. It's like, obviously that's not the case.
Well, brain, obviously.
Yeah.
Blood system, immune system, allergy system, and of course, as I've mentioned, the mental health system in the brain. Every bit of your body can be influenced by estrogen, progesterone, testosterone, and is. That's why I'm saying, it's like when I see, for example, women as they're going through the menopause story, will say, I don't know what's going on with me. I used to love bread, and every time I eat bread, I come out in big hives. I'm suddenly allergic to bread. And you go, yes, that's a change because you've got less estrogen now that you're in and through the menopause, and it has impacted adversely or impacted on your immune system. And that's where allergies are derived from. So, all sorts of things happen. So, I've had women who've come in saying, I think I've got nits, and they're 50 years old. They don't have little kids that do have nits, and they've gone and got KP24 and done all that. And they go, my scalp is so itchy, I can't stop scratching. And you give them some hormone, a little bit of estrogen, and it settles down. Why? Because estrogen is potent in the skin and the hair and the scalp. I mean, all of these areas.
Wow. So at its heart, when you talk about these imbalances when it comes to hormones, exactly how does that present in how we feel as women?
First of all, we always have hormone levels going up and down and sideways, right? That it does happen. And in the reproductive age group of women, there are cycles. And in the cycle, there are hormones in the hypothalamus or the higher centers of the brain that impact on the pituitary gland. They're different hormones, and then they whip the ovaries to say, produce some more of this, this, and this, or produce less. So there's a kind of chain reaction that goes on, and it's always in flux. And it's just incredible system. So that is always happening. So when people go, I've got a bit too much of this or a bit too little of that, how do you know that? And they go, I had a blood test. You go, really? Because it can change minute to minute. Some of these hormones. Yeah. And if you take a blood sample from your arm, which is where it mostly is taken, it's not going to tell you anything about what's happening in the brain. So that's number one. That's another myth as well. So we, unfortunately, at this stage cannot measure exactly what these hormones are doing in the brain. We can only do a sample from the peripheral blood, and that will show up, well, where it's important is if there's something really seriously wrong and the hormones completely abnormal levels. But most women don't have that. So within the otherwise physically healthy woman, you're always going to get fluctuations.
Okay.
So that's another thing.
How can you tell then when those fluctuations are different from what is normal? So an average up and down, not feeling great. How can you tell when it's slightly more serious, when you've tipped over and hang on, we need to get some serious help?
You know what? You ask the patient.
Okay.
And I find that women that I see, and particularly they come, let's talk about the 40-something-year-old woman who's probably coming along with the early stages of perimenopause, is so in tune with herself and her body, and she's an amazing repository of knowledge and information about herself. So she will tell us, she'll say things like, oh yeah, I know what I feel like usually at this time of the month, but something extra is going on. Or, the woman who's pregnant, and there's so many changes that go on during pregnancy, and she's acutely aware of all the different things. And the other part about it is to talk with her about her functionality. So it's not just how she's feeling, but what's the longitudinal functioning? I mean, is she able to go to work? Is she able to hold her relationship or with her partner or with her kids or, whoever? Is there some joy that she's able to experience, or what is she not doing the things that she would normally do? Does she look very different now to what she did a month ago, as in her life looks different, not her
Physical
appearance
appearance.
per se. So we put functionality questions to the woman, but more than actually putting questions to her, we actually just receive information, because most of the time it's all there. Yeah. So
Trust your body.
Trust your body, trust your gut instincts. I think we've kind of moved away from like, I know this is not quite right in my body, but no one's going to believe me if I just go into a doctor's surgery and say, I don't feel quite right. It's not going to come across well or something like that. And that's such a pity, because that is vital bit of information.
In terms of the cycle, and if we focus on a menstrual cycle for an average woman, how do hormones typically work across that length of time?
So the textbooks give you a beautiful picture of a 28-day cycle with ovulation at day 14.
Lovely cartoons.
And you get this, beautiful ovulation there, and then you sail through the period that lasts typically 3 to 5 days. Well, that's great as a textbook picture. I've very rarely met anyone who's like that, because there's so many variations. There's length of cycle can be anywhere from a short cycle through to a very long cycle. Or some women don't have a period for 3 to 4 months. They're fine. There's nothing wrong. That's just them. So it's difficult. And this is, by the way, why the rhythm method is a bit difficult.
What's the rhythm method?
The rhythm method, where people don't have sex when they think they're at ovulation. There's lots of babies born from that.
Yes.
So it's difficult because you can't quite pin down when that ovulation happens.
Because it changes.
Women, it can change. Some women, though, of course, are very intuitive about their ovulation. They actually feel pain in the lower belly, and it's called Mittelschmerz pain.
Wow.
Mid-cycle pain when they actually ovulate. And so the egg pops out and causes a little bit of a scar, so that's what they're feeling.
Wow.
Anyway, so that's very interesting for people who are trying to get pregnant. They
Yes.
can use that as a fertility marker. But a lot of women don't have that. So the cycle varies a lot, and the hormones are fluctuating from hypothalamus to pituitary to ovaries, back to pituitary and hypothalamus, with signals going all over to say, this is enough, no, make more, this is enough, et cetera, et cetera. And different hormones are at play. So the hypothalamus is producing its hormones. They're called releasing hormones or releasing factors. The pituitary is producing luteinizing hormone, follicle stimulating hormone, prolactin, a whole lot of others. And then you've got the ovaries producing estrogen, progesterone, testosterone. But adipose or fat tissue also produces estrogen. Estrogen is also produced in the brain and other parts of.
At a risk of simplifying this too much, estrogen is good?
All the hormones are good. They
Okay.
all have different things that they have to do. But if we just talk about mood, for instance, that depressive thing.
Yes.
Estrogen is a good antidepressant.
Right. Okay.
So estrogen is very good for mood. It's also very good for cognition, for memory, for doing tasks and things like that. Estrogen is very important for that. Progesterone is the chill pill. It's very good for anxiety and calming things down. It's also good for sleep. So you see in the third trimester of pregnancy, the progesterone goes up.
Okay.
And so that's why we have the very chilled sort of, she just rolls into the last bit of pregnancy.
I never realised that.
Yeah.
Okay.
It's also because progesterone makes the ligaments a bit more sloppy, so the pelvis can then expand so the baby can be delivered. So, I mean, the hormones have lots of effects. Testosterone is actually a breakdown product of estrogen. Yeah, so estrogen breaks down into testosterone, and then the testosterone molecule itself has different effects. So it can maintain muscle, and it also has a role to play in aggression, and can also be an energizing hormone as well. And women produce testosterone as well.
Yes. What outside factors, whether that be medication or lifestyle influences, how did they affect those hormones?
Yeah. Great question. And all of the above happens.
Okay.
So depending on the person's stress levels, diet, amount of adipose or fat tissue, age, bone health, all sorts of things come into that play, because this is a living kinetic model. And that's the other thing to remember. We are very responsive to what's going on in our environment. And by environment, I'm including, money, work environments, the actual environment with how green your space is and how clean the air is and all of that stuff, how good your nutrition is, whether you're being domestically abused or abused in some other way. I mean, all of these positive and negative factors are interplaying with the hormone world.
Wow.
And this is why, when some women have very, very stressful lives, say just, easiest to talk about work stress rather than the horrors of a traumatic relationship. But, in the work stress world, and then they say, they can't conceive, they're wanting to conceive, but they just can't. And they might then take a holiday or take a break or change jobs, and then suddenly
happens
she
just
gets
like that.
Pregnant. Yeah.
How does something like the pill affect your mood, and can it?
Again, great question. So first of all, the pill, we talk about the contraceptive pill as if it's one thing.
And
there are about
million.
60-something variety of the contraceptive pill on the market. Mostly you've got several types of pills. Some of them are progesterone only, and some of them are estrogen and progesterone. And some of them are injectable, some of them are in an IUD, and so on. So there's different delivery systems too. But mostly these are all synthetic hormones. And what we've found in our research over the many years is that the synthetic progesterone, which is called progestin, is its technical term, is often quite depressive in the woman who's sensitive to the hormones. So I've got to put a caveat in. Not every woman has a great sensitivity to her hormones in terms of her mental health.
Okay.
So some women can go through IVF procedures, which is, massive upheaval of hormones, sail right through it, no mental health effects.
It's a case by case.
It's a case by case. Whereas some women, just a tiny tweak of the monthly hormone, and they usually are small tweaks, can send her into a downward depressive spiral. So there's a big difference in the sensitivities. And the pill, similarly, in the sensitive woman can create a depression where there wasn't one before, because the synthetic progesterone is often the culprit there. And the pills that have, the older type of synthetic progesterones are probably worse than the newer pills that have a more upmarket progesterone, although there's still, I wish the pharmaceutical companies would get better with this. And then also the pills that have low doses of estrogen are probably going to be more depressive, because remember I said estrogen is the antidepressant.
So in that scenario, for someone who might be listening to this and is on the pill or is on some form of contraception and thinks that, oh, hang on, maybe I'm slightly sensitive to that, goes to speak to their doctor, they can try another avenue, try a different pill. Is that how
Yes.
you can, for want of a better word, fix things?
Absolutely. I mean, this is the consumer choice that we talk about here, because there are so many different brands and different combinations available. So some have higher estrogen, lower estrogen, and so on. So I would suggest to a woman who's looking for a good contraceptive, you're on a bit of a journey. You may be one of the lucky ones that can take any of them because you're not that sensitive to the hormonal shift, and that's great. That's fine. But in my experience, many women have to go on a bit of trial and error. But this is where I say trust your gut. If you know that on pill X you don't feel right, and a beautiful description, one of the women that I saw said to me, it's not that I'm, really depressed or whatever, but it's just, I can't get the highs, like I went on the roller coaster and I didn't feel like throwing my arms up in the air and whooping, and I used to.
Yep.
It's that muted. It's a different sort of, we can call it depression, but it's really technically called dysthymia, because it's not the depression that will make her take to bed and feel suicidal. I mean, it could, but it's more the sense of being irritated and life is just a bit grey and there's no great highs. Plus, the irritability will play havoc with relationships as well.
Yes, and then therefore it's this self-fulfilling prophecy. You're stuck in the cycle. Then you're limiting that joy.
That's right. That's right. It's interesting because most healthcare professionals will not say as part of their routine, have you felt joy in, today or in the last week or two? But I think women should ask themselves that. When did I last feel joy?
Why is joy important?
Because it's a marker of unfettered happiness that the individual feels, not the expected, it's my birthday and people are singing happy birthday to me and, I've got to smile because they've gone to all this effort. It's how did you feel? Did you feel joy at the fact that these people gathered and sang happy birthday for you?
I know this is probably an impossible question to answer, but if we were going to quantify that joy, how often should you feel it?
Ooh. Ooh. Well, that depends on the individual because some people are just more joyous than others. Yeah. Some people have really awful settings and environments that they're living in. And my hat goes off to incredible bravery that many, many women show. I sometimes tell my patients, if I had a medal, I would give you a medal for you have just achieved so much against so much adversity. So, in that case, I still say, but, what did you do for you? And so this is not quite joy, but it is pleasure as well. So sometimes I've taken out my prescription pad and prescribed half an hour of pleasure in a day. I don't care what it is.
Oh, I love that. And I do want to get to some more of the treatment options that exist and how people can help themselves. But before I do that, what happens to a woman's mood, hormones, when it comes to menopause?
Oh, yes. Okay.
Because we've got to dive it. Yeah, this is a big one. And I know I feel that recently, I mean, even on this podcast, but most recently when it comes to a culture and society, at least we say the word menopause now.
Yes.
Do you think that has been a helpful shift or is there some drawbacks too?
No, I think it's absolutely helpful. My generation was, this is secret women's business. Don't.
God, I hate that term. Yeah.
Don't talk about that, And that's not helpful. It really is not helpful. So the menopause story goes like this. It begins in the early 40s and the first early bits of it are called perimenopause. But perimenopause can go for 10 to 12 years. Menopause itself is one day in the woman's life when her last menstrual period happens and there's no more ovulation. That's menopause definition.
That's
as in
the point.
One day of her life. And then after that, she's post-menopause.
Wow.
But the perimenopause is the 10 to 12-year process leading up to the end of ovulation and periods. And the hormones go haywire because there are big fluctuations in the estrogen, progesterone, testosterone, and the pituitary hormones that make them happen, and the hypothalamus hormone. So the whole system goes into upheaval. Now, I'm not saying that that is a medical problem. I do not want to medicalize and don't medicalize menopause. So, as I said, millions of women can cope very well with the hormonal up, down, sideways. They sail through, and good luck to them. That's great. I mean, you can't outsource menopause, so everybody assigned female at birth will go through it. I'm not seeing everyone that's ever gone through menopause in the mental health clinic, right? I'm seeing a lot, but, so I do want to make that point. You don't have to have an icky, difficult menopause, but many do. And that's important to listen and be compassionate and do something to help those women who are really struggling, because we have capacity to do that now. So the first step is to actually talk about it, so that when you see women in their 45, 46-year age who are saying things like, and this happens in the clinic, I think I'm dementing. Yeah, okay, why? Well, I parked my car in the shopping centre and I couldn't find it. I had a patient who was a computer analyst, top flying computer analyst. She said, I stood in front of my computer, couldn't remember how to turn it on.
Wow.
At 46. It can be a sudden change in cognition. Fine, and then bang, I don't know how to turn on my computer, or I don't know how to find my car, or why did I walk into this room? That's an indication often that there's a cognitive change, which is an estrogen dip. And similarly, I have people who say, I just can't get out of bed. I can't stop crying. I can't get out of bed. I'm panicky. I'm really, really anxious. I'm hyperventilating, and nothing has happened. Nobody has made any new changes in my life. But all of a sudden, I just can't get out of bed because of all these things. Again, that's the depression and anxiety, which is also about a change or a drop in estrogen and progesterone. Then you have a whole range of other effects as well, including loss of libido, painful sex if it's penetrative sex, changes in weight. And this is something that really bothers a lot of women, that the perimenopause process is usually associated with weight gain, about somewhere between 2 and 8 kilos, regardless of how healthy and active and exercise program the woman undertakes. It's because the hormones are slowing down the metabolism of calories and fat and food intake. So that's another thing that happens. There are changes in the whole body. Women have presented saying, I'm suddenly urinary incontinent when I do star jumps, or I'm not doing star jumps. There's all sorts of changes in the bladder ligaments, and that's another issue as well. At the same time, we have women who say, God, I feel really feisty. I'm not putting up with crap anymore. I'm done trying to please everyone. I'm going to,
Which is a great thing.
I'm going to tell it like it is.
Yeah.
So, you get that side as well. Although sometimes there's also the intense rage that some women experience, and it's uncomfortable for them. I think if, someone's angry because of something, then sure, she has every right to be angry. Go ahead, express it. But there are some forms of rage that women experience at this stage of life that is not them, and that they are uncomfortable with.
And that can be that's such a scary thought, really, because it's like, yourself, you say to trust yourself, and then 1 second you become a stranger.
Yes.
We're going to continue saying it like it is, though, and we're going to find the joy and in treatment and life. That's going to be as our conversation continues. But if you are enjoying this conversation, you're learning a lot from it, you have people in your life who potentially might be going through a lot of big changes, hormonally or otherwise, and you think that they could benefit from this episode, make sure that you share it with them. We'll be right back.
Looking for a gym that's welcoming, safe, and just for women? You have to experience Fernwood Fitness. Designed for women, by women, our clubs have everything you need under one roof. World-class strength training, reformer Pilates, yoga, luxurious change rooms with daily essentials, and even a members lounge with tea, coffee, and complimentary breakfast. Book a free tour today and feel the Fernwood difference for yourself. Visit fernwoodfitness.com.au.
All right, we're back to solving the world's issues.
Of course.
Dr. Jayashri, of course. I think we've done quite well so far. We've also raised many questions. But when it comes to your work and your one-on-one work, you see so very many women who are struggling at different points of their life. When it comes to you working with them and their treatment, when it starts to turn for a good reason and they're getting through those struggles, what do you think those breakthrough moments are, or what have been some that have really stayed with you?
The absolute, this is my joy, is when you can actually turn someone's life around. So again, one of the most, really fulfilling things is working with women who have menopause depression. You know that they've got menopause-related depression. They're very fortunate to have the other bits of their life are all in order. But she stands the risk, or she's at the risk of all of that blowing up. And if you intervene at that perimenopause time, as we get the opportunity to in our clinic, at about 46 or 47, and sort of preempt the disasters, and we usually use hormone therapy, as in estrogen treatment plus progesterone treatment. And then you see her come back 2 weeks later. And I've done this. I mean, like the woman who's been an absolute total tearful, can't say anything, hyperventilating, can't get any words together, and looks completely disheveled, and it's just awful, had an awful time. And yet 2 weeks later, I've walked past her in the waiting room because I didn't recognize this person, who's now sitting there smiling and, looking really great. So that's absolutely joyful when that happens. And it's so annoying that it doesn't happen more. It doesn't have to be my clinic. It could be anyone's clinic who's a healthcare professional and able to properly use hormone therapy and prescribe it and follow it up and make sure, physical health is good, because it's out there. This is not some weird, mysterious drug X. So I know that many women are scared of hormone therapy.
Yes. Why do you think that is?
Oh, there's a big story behind that. In 2001, there was a study called the Women's Health Initiative Study.
Yeah.
It got debunked, but it made sensational headlines in the general media. Took it up and said, hormone therapy kills women through breast cancer and strokes and blah, blah, blah. And of course, women threw away their HRT, as it was called then. It was called HRT. We now call it MHT, menopause hormone therapy. And even though that was 2001, there's still doctors who say to me, oh, I can't possibly prescribe HRT for the patient you saw because, there was all this stuff about breast cancers and all the rest of it. And I went, that was 2001. It's 24 years ago.
What's your uncensored reaction to that when you get that?
Because I can see this poor woman who's really suffering, and she's saying, I want the hormone therapy. I never push hormone therapy on somebody who doesn't want it, because there's plenty of women who will say things like, hang on, could I do? And, they're not suicidal or having that sort of level of concern. They're saying, can I do this through exercise and eating well and yoga, meditation, maybe buy some over-the-counter stuff? And go, great, let's go on the journey. You go and try those things and we'll see how you go. And I'll be here to applauding you with your journey and hope it works. And if it doesn't, we've got other options. So, it's always choice, the woman's choice. But some women say, I've read that, this stuff is really bad. So for those women, I want to say, no, get out of 2001. It was 24 years ago. If you need hormone therapy, and provided you don't actively currently have breast cancer, or there isn't a big story of breast cancer in all your female relatives, then more than likely you're going to be fine. But yes, everyone who hits 40-something 40s onwards, must have breast health checks, pap smears, blood pressure checks on a very regular basis. You just do. You just have to. So do all that. But in actual fact, the sorts of hormone therapies that are around at the moment are not the ones that they were trialled on. There is a window of opportunity to use hormone therapy. Once you get past 60, for the brain, it doesn't really impact as well.
Okay.
So that's important too.
When you talk about your patients kind of getting their life back in a way sometimes, regardless of the treatment, regardless of what point they are in their life, what does that look like?
Oh. So I'll tell a story about, let's call her Pauline. That's not her real name. Pauline is a barrister, high-flying barrister who was rather conservative, very proper woman who came in always immaculately groomed with pearls and pearl earrings and so on. And she said, I'm so angry all the time. I'm swearing like a trooper, and I don't usually use, 4-letter words, but the 4-letter words are just coming out of my mouth all the time in all the most inappropriate situations. And she said, look, I'll get on the lift or I'll get on the escalator in the shopping centre and I start swearing at all the people ahead of me who won't move out of the way. And I want to get a gun and shoot them. And I'm sort of like, whoa. Have you got a gun, Pauline? No, she hasn't. But anyway, so she then described that was the onset, but then she also developed tearfulness and she also developed anxiety. And for Pauline, public speaking was her thing. And all of a sudden she had word-finding difficulties, that tip of the tongue, what's that word? But for a high-flying barrister, that was awful.
That's a big problem.
Yeah, she said, I knew that my colleagues were laughing at me and thinking I'm past it, et cetera, et cetera. And then she said, is this a dementia? Because she said, I'm finding it difficult to keep the different sort of strands of argument in my head, which I did, like that. And eventually, we had several sessions and I suggested to her that she might like to try hormone therapy. First of all, she was appalled. She said, but I'm only 47. I went, yes, it's not, the 50 plus. We're talking about perimenopause. We're talking earlier. She said, all right, okay, I'll give it a go. And she, 2 weeks later, said, I'm back. I'm back. I'm just back to where I was. Now, it was an easy intervention for her because she had a supportive partner. She had no financial stresses.
This is this holistic
approach,
and
I went through all that.
Support.
There was nothing particularly else going on. And I got to see her as all these symptoms were unraveling. The sad thing is we lose women to suicide who have years, because I said this is a 10 to 12-year process. A lot can go wrong if you're not able to function. It's a fluctuating condition as well. So sometimes people say, wow, I woke up and I couldn't get out of bed. I was really depressed. I was crying. I couldn't think. I was hyperventilating. And then that stayed for 2 weeks and then I was fine. And then it all came back 3 weeks later. And that goes on for years. And what happens there is there's a destruction of the career, the work, the relationships, the kids' if they've got kids' relationships there. And then, I've seen terrible stories where people are then struggling with, they've now not got a job, they've got a divorce, the kids are really unhappy and there's problems there and so on and so on. More difficult to intervene. And often that woman has got a bipolar disorder label because she's been down and then supposedly up, but she's not really up. She's just back to herself. But everyone's forgotten what normal looks like for her, including her. So the sad stories are if you don't pick up on it quicker before the life factors start to then become destroyed.
When it comes to mental health speak, how would you adjudicate social media and people's algorithms in a world where everyone kind of uses therapy speak and thinks that they understand exactly what's happening? What do you think of that?
I like the psychological mindedness that's happened in generations. At least
I feel people are aware of it now. They're interested.
Better psychologically aware population. But it's like, when somebody says, I've got a new idea for a psychological awareness campaign, you go, oh gosh, how much more psychologically aware do you want people to be? We need the next bit, which is now, what are you going to do? You're aware.
Yeah.
What are you going to do with the awareness?
Mm-hmm.
So that's another whole issue. But I think that basically psychological awareness is important. But if all of your information is coming from TikTok and it feels ridiculous to you, then it is ridiculous. And check it out against some other things. And most women that I see have already done good searches and gone to different forms of advice and literature. So, for example, if you want to find out about menopause, go to the menopause websites that are reputable. Like, there's several. There's the Jean Hales website. I mean, Her Centre Australia is my centre. We have our own Her Centre Australia information, the Australian Menopause Society. I mean, these are reputable places, and that's good. Inform yourself, please, go, read, do that. That's great. But if you come and you say, TikTok said I should rub toothpaste on my head to deal with hot flushes, then no, please don't.
What would you say your relationship with your own mental health is like?
I always feel really lucky. I feel incredibly fortunate. I have never had a formal mental ill health condition. I got a bit depressed when postnatally, but it wasn't to the point where I couldn't function. And it was only after I stopped, and your nursing mothers are going to hate this, but once I stopped breastfeeding, I thought, okay, this is how I'm supposed to feel.
Yep.
So it was sort of retrospectively, I thought, I wasn't particularly enjoying. But apart from that, I've been very, very, very fortunate. I had a wonderful, wonderful mother, and she was just brilliant. She was just helpful all the way through my life. Was a brilliant role model, but also just rolled up her sleeves. She would just do things practically as well, and so on. I have been married now. This is going to be 44th.
Congratulations.
44th wedding anniversary coming up.
You do not look old enough to be able to have a 44th wedding anniversary.
I'm ancient. In fact, it's my husband's birthday today, and he turned 69. And I looked at him and thought, wow.
How did we get here?
Yeah, I know. Like, what happened? But so again, he's my rock. So again, I'm really fortunate because, yes, I have my today's clinic was so awful.
Yeah.
And so he'll just sit there and say, yep, I bet it was. So, it's really interesting. I do the up and down, whereas he's just steady.
Would you say it is that support system then that helps you? Yes. So when you are going through that little bit of a roller coaster.
Know who is genuine in your life. You be genuine. And that's sometimes the other thing. It's hard to be authentic, especially as a young woman, because you're always desperately trying to be cool or be beautiful or be particularly brilliant or be particularly radical or, you're trying on different personas. And that's what adolescence and young adulthood is about. You got to experiment a bit, but then eventually get some authenticity so that you feel confident and good in yourself as a real self. And if they don't like your real self, we'll stuff them.
I need that on a tattoo, I think, Dr. Jayashri. I've got a couple more questions before we wrap up, but the concepts of PMT, PMS, are they real? Are they real?
Absolutely, they're real, and they're all different as well. So they're not interchangeable. So there is PMDD, premenstrual dysphoric disorder, is a serious major depression that occurs once a cycle, but it can be sort of a cycle that's 2 months or whatever. And it has rapid onset, really severe depression, and rapid offset. PMS is premenstrual syndrome, which is where women have physical symptoms like bloating, feeling a little bit cranky, maybe craving, a bit of sugar or whatever, but it's not the severe depression. It doesn't really get in the way. Headaches can be a problem. So PMT is a bit more like PMS. PMT is probably the earlier term. So PMT, PMS are down the end of the spectrum. PMDD is really significant. Then there is another thing, which is premenstrual exacerbation, PME, which is for women who have already got existing mental health conditions like ADHD or autism or whatever, that gets worse with their monthly cycles.
Really?
And that's called PME, premenstrual exacerbation.
Why does that get worse?
Because estrogen and progesterone, as I've said, are brain hormones.
Yeah.
And they're going up and down in levels in the brain. ADHD, migraines, epilepsy, these are all brain conditions. So the circuits in the brain are all interlinked and they're all driven by hormones. So again, if you get a dip in one hormone or two hormones, you're going to then have the circuitry and the other chemicals go a bit wild.
How can our listeners find you? Not in a creepy way, but
Her Centre Australia
yes.
has its own website. It's a Monash University centre. So Her Centre Australia, please look at our website. So that's one thing. We have one of the joys of my life was I was in the privileged position of setting up Australia's first women's mental health hospital at Cabrini Health. So Cabrini Health, it's called the Lisa Turin Women's Health Centre. So it's Australia's first women's mental health hospital, and that's based in Elsternwick in Victoria. So we develop a model of women-centred care, and we've now exported that, so there are many more women's mental health hospitals. The Alfred has one. It's called Wren, and that's for public patients because Cabrini is private. And I was over in the West talking to our colleagues in Perth, and they've used the same model to set up theirs. There's going to be one in Brisbane as well. So I'm delighted that, hey, women matter. Did you know that women matter?
What?
Women are important.
That's crazy. You've lost me again.
The message is finally out there. So there's that. Those places also have resources and information specifically for women.
What would the one takeaway again be for them? What do you hope, this is your final message, that they take from this podcast?
Be kind to yourself. Be authentic about who you are. And never, ever, ever give up on your goals.
If someone is listening to this chat and they're thinking, okay, I'm maybe teetering, I'm not doing as well as I potentially could, how do they go about getting help? What should they do?
I still think that our primary healthcare practitioners, our GPs, are a really good first port of call. Now, having said that, I know that some GPs are not particularly au fait with all the latest in women's mental health, but you can shop around until you find
I think that's the key
GP.
message, is shopping around.
Yeah, find a GP that you are happy and comfortable with, and there are many, many great GPs. In fact, GPs hold up our healthcare system and work extremely hard. I'm delighted that there are some interesting menopause clinics developing as well. So, find that out. And this is where the Female Friends Network is really important, because you can test things out and say, oh, that person was really great or that person wasn't so good, etc. So find a good GP. Again, if it's a menopause problem, then go find the specialist menopause clinics and so on. There are fewer, but some places work particularly with PMDD. But you've got to look. Unfortunately, it's not yet out there in a really easy way. So go to GP, educate yourself, not from TikTok, but somewhere reputable, and keep talking about it. Really important. Do not keep this to yourself. Do share it and understand, and take knowledge from people around you. The next generation up will have something to say about what they went through.
On that sharing, if someone maybe is listening to this and they recognise things that we've talked about in someone close to them, a loved one, a friend, how do they help them without, for want of a better phrase, drowning?
I think if you know that your friend, sister, mother, whoever in your life is struggling and you think, I think this is, midlife struggle or something else, it is important to have an honest conversation. That is not labeling or in the middle of an argument or, name calling or anything like that. It's at a quiet time to say, I'm really worried about you. I've noticed that you're just not yourself. You used to do this, and you're not doing that anymore. And I really want to help you. If you have an honest conversation with compassion, you'll probably get through. But if somebody is in the middle of a rage episode or there's something else that's acute, wait. Just wait until the time is right. But also, you are not going to make somebody depressed or anxious if you ask them about depression and anxiety. We've got this sort of, can't possibly talk about that. It isn't. The other thing that's really important and difficult is to say, have you felt so bad that you've thought about ending it all? If you don't ask, you won't get the information. And, that is an important area to confidentially get information and then go with the person to their doctor.
You've got to, it's about, it's courage on both fronts, right?
It is courage.
You have to ask the question and hold the space for the person then to be brave enough to tell you.
Yes. And it's difficult if the expression of depression by the other person is rage, because if someone's sad and tearful and, they're just not able to do anything, then they're more likely to go, help me. Whereas if someone's, it's hard to get past that. But if someone is uncharacteristically angry, stop and think, why? So, I know I'm asking people to be saints and not just respond. You need to stop and think, if this is out of character, why? Why is this happening?
Dr. Jayashri, thank you very much for joining us on Fernwood Unfiltered.
My pleasure. Thank you for having me.
We'll speak soon on the next episode. Thanks for listening to another episode of Fernwood Unfiltered. Just a quick note that the information shared in our episodes is for general educational and informational purposes only. It is not a substitute for professional medical advice, diagnosis, or treatment. So always seek the guidance of a qualified health professional regarding any medical condition or concerns you may have. Catch you in the next episode.
Thank you for tuning in to Fernwood Unfiltered. If you learned something from this episode, help support the show by hitting follow and leaving a quick review. It's free, takes 30 seconds, and helps more women find us. Thanks again for being part of our Fernwood Unfiltered community. We'll catch you in the next episode.